Hi everyone, welcome back to my YouTube channel. So in today's video, we shall be discussing how to diagnose a disease. So how do we diagnose a disease? For us to diagnose a disease, we must have knowledge about anatomy and physiology. We have physiology. So physiology is the normal functioning of the body. So physiology is the normal functioning of the body, while anatomy is the structure, is the study of the structure of the body. So for us to diagnose a disease, we must be well conversed with the knowledge of physiology and anatomy, because when someone is healthy, the normal functioning of the body organs are normal. But once a disease has affected the body, so the normal functioning of the body will be disrupted, will be altered. So that is what we call pathophysiology. 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 So pathophysiology is the abnormal functioning of the body. So how do we know the nature cause of a disease? So for us to know the nature cause of a disease, we must be well conversed with etiology. Etiology. So etiology means is the study of the cause of a disease, is the study of the nature cause of a disease. So what a disease cause? A disease can be caused by either genetic disorder. A disease can be caused by either a genetic disorder, that is a DNA, an inherited medical condition that can cause a DNA abnormality. So a disease can be caused by a genetic disorder, that is abnormality, or environmental disorder. Environmental disorders. So example of environmental disorders include radiation, or nutritional factors, or economic factors, or maybe pollution. So for example, what we have access to, economic, is what can affect the way we behave or our culture. So that one can cause maybe any stress related factors that can cause a disease, or maybe a disease can also occur because maybe air pollution or radiation from too much sunlight or electric power. A disease can also be caused by epigenetic. So epigenetic refers the way we behave in our environment that influence or that can cause change the way our genes work. For example, what we do, what we eat, and how we behave is what influence our genetic makeup. So that can cause any alteration in our genetic constituents. So that's one is what we call epigenetics. For example, what we do, what we eat, or physical activity, or the type of food we eat is what can cause a disease. For example, too much eating disorders that can cause obesity. So that is epigenetic. So a disease can be caused by either genetic disorder, that is DNA, environmental disorders, maybe air pollution, radiation, and electric power, or work balance. Epigenetic is what influences our behavior and environment that can cause and make a change the way our genes work. So a disease can be caused by these three factors. So when a disease affects the body, then there will be a possible of sign and symptoms. So is what we call clinical features. So clinical features are the sign and symptoms the patient complains. For example, we have sinus. So sinus is what we can detect from the patient's experience. So sinus are the features or the clinical features that we can detect from the patient's experience. For example, his body. So we can look, or we can feel, we can listen, and we can tap. We can also smell. For example, if a patient has abscess or a wound on the skin, so we can smell it. We can look, that is inspection. We can feel, that is palpation. We can listen, that is auscultation. We can tap, that is percussion. We can place our fingers or we can tap our fingers on the patient's body to detect any abnormality in the that has been caused by the disease. Okay, what about symptoms? So while symptoms are the problems that the patient complains, so symptoms is what the patient complains. So we can use tools for us to recognize the symptoms of a disease, or we can apply a formula called PQRST. So P means provoking any factors that may alleviate, that can make better, or that can worsen the symptoms of the patient. We have quality. For example, is the patient feeling better, or is the patient symptoms worsening? R means region, so we can detect the regions that has been affected the symptoms of a disease. S means severity, so how is the pain look like? So we can grade it in a scale from 0 to 10. We can grade it from 0 to 10, severity of the patient's symptoms. While T is the timing, that is the cause, the duration, how long is the patient suffering these symptoms. We can also do history taking. For example, history of present complaint. We can ask the patient's major concern, what the patient has been brought in the hospital, the major complaint, that is a chief complaint. What the patient is complaining right now is what we can do history of present complaint. We can also do general medical past history. General medical past history. We can also do general medical past history for us to recognize the symptoms of the disease. Okay, after we see the clinical features, is what we can do, or is what we can observe, and observations. So observations are the internal function of the body. For example, we have the BB, we have the SBO2, we have the temperature, we have the respiratory rate, or we have the temperature. From the observations, we can measure and record, that is blood pressure, SBO2, that is oxygen saturation, PR, pulse rate, respiratory rate, and temperature. So we can recognize the compelling symptoms of the patient from these observations. Then after observations is what we do, the investigations. So investigations are any procedures that the doctor do to confirm the nature cause of the disease. For example, we have investigations, we have hematology. So hematology, example of hematology include CBC test. The doctor will do a complete blood count test, or your doctor can also do microbiology. So example of microbiology test include, we have urine, we have blood, we have stool, we have sputum. So from the microbiology, your doctor will perform several tests including urine analysis, blood culture, stool culture or urine culture, and sputum to detect if there is any TB. A doctor can also do radiology by using computerized testing of radiology. Example of radiology includes, we have the X-ray, we have ultrasound, we also have magnetic resonance imaging, that is MRI. We also have CTS, that is computer tomography, scan. We also have endoscopy. So your doctor will do several radiology tests including X-ray, ultrasound, magnetic resonance imaging, computer tomography, scan, endoscopy to detect if there is any abnormality in the internal of the body. So that is what we call investigation. Your doctor can also do biochemistry. So your doctor will also perform a biochemistry test. For example, we have the level of albumin, creatine level, the level of creatine, the level of protein, and the level of bilirubin. We have also bilirubin. We also have lipid profile. We also have lipid profile. So your doctor will do biochemistry medical tests, that is albumin, creatine level, protein level, bilirubin level, or lipid profile, that is abnormal cholesterol. So your doctor will also do microbiology testing. Then after your doctor do all this is what he will go to assessment. Assessment. So in the assessment, your doctor will provide for you a possible diagnosis. For example, final diagnosis. Then your doctor will do a plan. So for example, your doctor will take an action to treat the disease that you are suffering from. Then from the plan, your doctor will do evaluation. Your doctor will do evaluations. Then last, your doctor will do interventions. So for us to diagnose a disease, we must be well conversant with physiology. We must study the normal functioning of the body. Then we must know the structure of the body, both internal and external. So pathophysiology is the abnormal functioning of the body. So for us to know the nature cause of a disease, we must study etiology. So we must be well conversant with etiology. That is, a disease can be caused by either genetic disorder, environmental disorder, or epigenetic disorders. Then when a disease has affected the body, so there will be a possible sign and symptoms is what we can recognize from the clinical features. So the clinical features are what we can recognize, or what we can know more about the pathophysiology of the disease. Then in the clinical features, we have signs and symptoms. So the signs are the signs that we can detect, we can see, feel, and look, or we can tap it. For example, we can smell, we can look, we can feel, we can listen, or tap. So look is like inspection, feel is palpation, listening is auscultation, and tapping is like percussion. We can tap our fingers from the patient's body to know the signs, the compelling signs. Then we have the symptoms. So we can use tools to diagnose the possible symptoms of a disease. We can apply BQRST, that is provoking factors, quality of the symptoms, regions that has been affected by the body, severity of the symptoms. For example, how is the pain? We can grade in a scale from 0 to 10. We have T, that is the timing, the duration, how long is the patient has been suffering these symptoms. Then from there, we can do the observations. We can measure and record observations. For example, blood pressure, oxygen saturation, pulse rate, respiratory rate, and temperature. So after that, we do the investigation, is any procedures we do so that to confirm the nature cause of a disease. For example, we can do radiology, that is computerized testing, including magnetic resonance imaging, X-ray, ultrasound, computer tomography scan, and endoscopy. Your doctor will also perform hematology testing, that is complete blood counting. From there, your doctor can detect if there is lymphocytes, for example, WPC, lymphocytes, and monocyte, or basophil, or eosinophil. Your doctor will also do a microbiology test that includes urine culture or urine analysis, blood culture, stool culture, and is button test to detect or to screen for TB. Your doctor will also do a biochemistry test, that is realizing the level of albumin, the level of creatine, protein, bilirubin, lipid profile, or electrolyte imbalance, or if there is any hormonal imbalances. Then from there, your doctor will do an assessment. So he will provide a possible diagnosis for your compelling sign and symptoms. Then he will reach a plan, that is, he will take an action to treat the disease. Then from there, your doctor will do an evaluation for your possible condition, then an intervention. We can do an intervention for the patient's concern. So this is how we diagnose a disease. So thank you for your watching. Have a nice day.